The Lees? Can I have the Lees? Are you two the Lees? Do you come back with me right now? Did you check it in? Normal. Everything seems normal. It's a slight fever, so I'm just going to prescribe her some antibiotics. You could give it to her once a day for an entire week, and then you'll come back a week later and we'll do a follow-up afterwards, if that's alright. Okay, that's nice. When the Lees came in, I know they were of Asian descent, but I didn't know what kind of culture they came from. When I first saw Leah, I saw that she was slightly had a slightly raised temperature. Did my first examination of her. She had a raised temperature, swelling in her throat and in her ears. So I thought it was to my discretion, I thought it was an infection. So I prescribed some antibiotics. I talked to both the parents about it, and it kind of seemed like they didn't know what I was talking about. So I did as best as I could. I told them to take the antibiotics for 7 days a week, once a day to administer to the patient, and just let them go. There's nothing else I could do.
Baby seizing, I'm gonna give her 1 cc of Valium. Okay, so I know last week when you brought Leah in here, she had a fever, but we didn't know that it was actually epilepsy, so that's why she has a seizure, so the antibiotics aren't gonna work for that. So we have to give her a new medicine. It's called Valium. You have to give it to her 3 times a day, at morning, lunch, and night, and you give her 1 pill by mouth. You understand? Understand? Okay? Okay. So if they understand, I need you guys to read through this and then both sign it. Okay. See you guys next time. Baby Lee came into the ER again, 800 hours. This time she was mid-seizure. We managed to get an IV in and aborted the seizure with Valium. Diagnosed it as epilepsy, prescribed phenobarbital to the family. A translator was present to relay instructions. I wasn't quite sure whether they understood what they were being told, but they appeared as if they did. They're Hmong family. They believe that a spirit or a dab caused the seizures. Personally, I think it was a genetic predisposition to epilepsy. There was nothing they could have done.
Are you experiencing social anxiety disorder? People not laughing at your jokes? See your doctor for Zoloftia today. Zoloftia does things to your serotonin and norepinephrine to help you make friends.
Side effects include high blood pressure, dry mouth, insomnia, shortness of breath, heart palpitations, flaky skin, persistent body odor, irritable bowel syndrome, suicidal tendencies, HIV, hallucinations, chronic feet and palm inflammation, color blindness, eye floaties, belly button conversion from innie to outie, fat, curling of toes, elephantitis, hyperactive sweat glands, ability to hear dog whistles, diarrhea and/or constipation, stroke, osteoporosis, heart attack, and possible death. If your erection lasts for longer than 4 hours, be sure to seek immediate medical attention. What a ride. Look at those lines. Beauty.
Hey son, what are you doing?
Just checking out your sweet ride, Pops.
Well, I've been thinking, you're getting older, your voice has started to drop, it's time for these sweet wheels to be yours.
What? Yes! Oh my god, score!
They see me rolling, they hating, patrolling and trying to catch me riding dirty, 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 trying to catch me riding dirty. My music's so loud, I'm swinging, they hoping that they gon' catch me riding dirty, trying to 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 catch me riding dirty.
From generation to generation, Chevy runs deep.
Mr. and Mrs. Lee, do you understand that the levels of medication that you're giving Leah aren't the levels we prescribed?
Which medication were you talking about?
We found that dapakine was prescribed twice as much and phenobarbital was half. What is this?
Well, they took twice as much of the one medicine because they were saying that it made the baby feel better, but the other medicine made the baby hyper, so they cut it in half.
Do you understand that this is not what we prescribed? The levels that we indicate are good for Leah.
He says they'll do better next time.
Well, tell him good.
I think we have an understanding.
Okay, well, I have to go now. I have some more patients, but if Leah does this again, give her her correct medications. Thank you, Mr. So I come from a background with very westernized medicine, where there's a physical cause to every single disease, and usually a medication that can treat it. But with the Lees being so difficult and not taking or giving Leah the medication, I believe that they're causing more harm than help to her. I also have a very humanitarian outlook, where I want to help everyone, but they just seem so resistant to me, it seems like a burden. We can help them, but it seems like they don't want to help themselves. And I feel like I'm culturally tolerant, but this conflicts with what's going on, and it's not helping Leah, it's hurting her. So I just wish Neil was here. It's out of control.
I just don't know what to do. It's just so frustrating. I mean, on the one hand, I understand the cultural barriers and that this just isn't what they believe in, Western medicine and all, but on the other hand, I'm just watching their daughter suffer and I don't know what to do about it. And I just don't know how this should be handled. I mean, it's just so frustrating seeing things get progressively worse and worse, and knowing that I've got to fix, but they're just not compliant and they just won't do it. But should I call child services? Should I have their daughter taken away from them simply because of culture, because of what they believe in? But at the same time, just to watch their daughter suffer and get progressively worse and worse simply because of religion, because of culture. It's just so hard. I don't know what to do. Such a decision. just so frustrating. Yeah, I think I'm gonna have to make the phone call. Yes, Child Services. Hi, this is Dr. Neal, and I am calling to discuss a patient of mine by the name of Leah, and she is a child with epilepsy, and I'm afraid her parents are not handling this situation appropriately, and I believe she needs to be taken out of their custody and taken into custody by Child Protective Services. Yes. Yes, just call the office. We'll leave a number with you, and we can figure this out with the paperwork. Thank you.
Oh my god, she's having a grand mal seizure!
Oh man, we can't get her under control. Nurse, hold her down.
Nurse, down, go!
Alright, Valley, stat. Hold her down, hold her down. I think she needs a catheter.
It's not working, Neil! It's not working!
Maggie! She needs a catheter.
Scalpel, nurse! Scalpel! I'm gonna have to do an intravenous catheter in the leg.
There you go, almost got it.
It's in, she's seizing.
She's calming down.
She's seizing, Neil!
She's calming down,
Neil!
Maggie!
Okay.
She's finally stabilizing. Let me
Get her
check her
stats.
breathing.
Leah, can you hear me? It's Peggy.
There's a heartbeat.
She's stable?
I can hear she's breathing.
She's stable?
Let's check her
Nurse,
eyes.
we need stat. Yeah. What do you see, nurse? What's your conclusion?
She's brain dead.
I think this has been the hardest case of my life. I've just felt so connected to Leah, and I've had such a desire to make her better. I've never felt this way before, and I've tried so hard. Everything I can think of, I've done, and just due to the culture, to the family, their unwillingness to follow the drug regimen as prescribed, just nothing's worked out, and it's just led to me making some decisions I never thought I'd have to make in my life. I had to call Child Services. I had to have her taken away from her family, and things still didn't work out. The poor girl's still brain dead, and things just...
Paging Dr. Murphy.
Things just aren't working out, and I just don't know. I can't even walk past her bed anymore. It's been 3 weeks, and I just can't. It's just been so hard.
Muy bueno! I don't have any cash today, but can I pay you in Trident layers?
Ay, Dios mío, claro que sí!
Nobody ever pays me in Trident layers.
Now I got my Trident layers, it's time to dance.
I don't want to do the dishes. I got a book to read too. What's in here? Hey there, my little friend.
Can't get it together in the morning? Don't have time for coffee? Just pop back a 5-hour energy and finish all those chores you've been meaning to do. Why not read that book that you've been putting off? Interesting.
5-hour energy. Fix the tire.
Lily is a Hmong patient having grand mal epileptic seizures.
Leah came to Peggy and I in pretty severe condition. We've been treating her as successfully as we can, but it's been rough. We've been having non-compliance with the patient's parents, They've had cultural objections to the medications we've been trying to prescribe her with, and as a result, I had to make the unfortunate decision to call Child Protective Services and have her taken away from her parents' custody.
We've also had a language barrier. It's been difficult in the presence or absence of a translator to convey the messages and instructions we need for the prescribed medicines that could have contributed to the non-compliance. They also come from an interdependent family and not used to our independent, westernized ways of medicine.
So the case ended up ending with Leah having a large seizure that we had all feared from the beginning. Turned out to be brain dead at the end of that, and we really feel like we could have done a better job. Well, not so much a better job, like we have the tools, we know how this disease works, and we really feel like if they had followed the regimen, that she might have had a better outcome in the end.
Well, I fear that as doctors, we're not being very lending, I guess, to their needs and their wants. It's not our culture. We don't know it very much, but you know, there should have been some signs or some things that we definitely could have done in order to better provide for this patient. This Hmong culture is prevalent in this area. I feel like maybe we could have had some more interpreters, or better interpreters for that matter.
Part of our kind of Western approach to medicine, we see the patient, we diagnose them, we treat them, it's just kind of in and out, you know, boom, 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 get it done. And, you know, that just really kind of conflicts with their culture. And I think that might have really caused some problems with our treatment.
At certain points, it can make us less personable.
I kind of feel like if we just talked to the family, we would have had a overall better experience, whereas like our independent westernized medicine, we like to only talk to the patient, when in this case it was a relative, because we couldn't have a translator give us the information that we needed about the patient.
I think the major problem that we have is our humanitarian outlook. You know, we try to help as many patients as we can and diagnose on a biochemical basis, like a simple cause and effect and potential cure for the disease, and that's kind of what we did here. We didn't really pay attention to the family.
So this makes me think about an article I read recently by Marcus and Kitayama that talked about interdependent and dependent cultures. And maybe if their culture is a little more interdependent, I would view ours as being more independent. And so when maybe we didn't relate enough to them, maybe we didn't talk enough to their family, maybe we didn't ask them, maybe we should have asked them, how do they feel about this disease, or how do they deal with it, or what are some of the aspects that they go through?
Well, it brings a good point, because as physicians, I feel, and personally I feel this way to a certain extent, that we have this ethnocentric type of a view, where we tend to push or believe that our diagnosis, our values, these are the right things. When we're not looking at our patient and really catering to their wants. They may be needing something. We know what they need, but they also want something, and we need to be able to be a little flexible with that. And maybe we went a little wrong with this case. Maybe we didn't identify some of those wants, or we just weren't flexible enough. What do you guys think?
I think we need some more cultural knowledge coming in here.
So that also makes me think, some of the strengths about our culture and Western medicine is that we can extend people's lifespans. We can.
At what cost?
Right. We can cure these diseases. We can, we diagnose people quickly. We go through patients. And then maybe that's not what they're really looking for. Maybe they need something a little bit more than that.
Well, more often than not, it seems like we have just a cut and dry solution to it. We diagnose the problem, and again, we know what the cure is, and we just want to diagnose. We just want to prescribe that right out of the gate. We don't want to take into account the individual patient, what's going on in their life, and maybe any personal issues that are going on within their life, their family, their culture that might influence the whole situation. And I think that really it puts a drawback to our use of medicine,
And I kind of think that allows us to go back and see how effectively we can treat the patient. If we have enough time to diagnose it and get it under treatment, then it's going to be a lot more manageable to take care of rather than letting it spread.
Yeah.
And even though that is a weakness, we don't have as much, we can't pay attention to the patient as much, but we still have this time-effective treatment to anything that we can come across at a biochemical level.
And in a case like this, where we did have a cut-and-dry diagnosis of epilepsy, and we have treatments for it, medications to reduce the amount of seizures, medications to abort seizures. In this case, the Lees, they have interdependent culture. They're not really confident in Western medicine, so they, didn't trust the medications. They second-guessed them, and that led to the non-compliance. So even when we have, clear-cut examples, it's hard to force compliance across cultures.
I feel like that we're not as culturally knowledgeable as we should be coming in here.
So I also feel that maybe our Western culture itself is affecting how we've been treating Leah. We really seem to value this long life and prolonging the life and being able to cure the disease rather than thinking more about, is she gonna have a better life without it? Is this what the parents want? So maybe that's something we should also think about.
I think it's an issue when physicians take it upon themselves to determine whether the quality of life is going to be better with our treatment or, like you said, with the parents, whereas we don't know if the parents have a better solution to this type of disease like epilepsy.
Well, I mean, it's almost, think back to med school. I mean, it was taught to us, this is the way we diagnose a patient. It's X, Y, and Z, and this is what it is. If we're going to change this, we can do it amongst ourselves, but in order to really get physicians across the U.S., it's definitely going to have to go into a much broader, program, if you will, within med school itself.
Although I think the responsibility does kind of lie more on us, at least to an extent where, we have to recognize the fact that there's a large Hmong population here where we live, as well as other populations, and there's regions all across the country that, they have certain sects of culture that are really prevalent there.
Right.
And I think we need to kind of take the initiative to research that culture and to just kind of, at least have an idea of what's important to them and what their values are so that we can better treat them, since they're going to be such a large percentage of our patients.
Right. How do you think we could do something like that?
Well, I think we could all take HMHV 310.
Yeah, I remember back in my undergrad hearing some students talk about taking a class like that, and it just sounded like a really good class. And, I just feel like if we had been more aware of this cultural stuff, if this had been something that we had focused on from the start, we probably could have really just nipped this whole situation in the bud. And, unfortunately, Leah's brain dead now, and there's just no going back. And I think we really could have taken better steps to prevent this from happening. Live and learn, I suppose. Any last comments, guys?
Alright.
Guess we'll just wrap it up.
All right.
Here.
Thanks.